Information and fears surrounding the latest Ebola outbreak, and the spread of false information is complicating efforts by health workers to respond to this disease and build public trust. The International Committee of the Red Cross is among the organizations working with affected communities amid these concerns. Well, let's get a little bit more now from Alex Locke. He's the communications coordinator with the International Federation of the Red Cross and Red Crescent Societies based in Bunia in the Eastern DRC. Alex, thanks very much indeed for joining us, and welcome to the program. Okay, we're hoping to get hold of Alex Locke in Bunia in the Eastern DRC. Alex, are you there?
Yes, I am.
Thanks so much, Alex. There are reports of 6 of your colleagues being injured by attacks last week, similar attacks last week. What can you tell us about that?
Yes, unfortunately, as the country faces the largest and even the deadliest Ebola outbreak in its history, the response personnel who are on the ground to provide essential support to the community continue to face mistrust and sometimes even hostility, which frequently escalate into attacks. In over 100 days of our response, the International Red Cross and Red Crescent Societies movement deplores and condemns 11 incidents separate and in which a total of 12 staff and volunteers have been injured. Essential humanitarian equipment, including ambulances, destroyed. This is a concerning situation at the time we are fighting a very deadly virus. In this situation, we continue to call on local leaders, authorities, and all stakeholders to increase the acceptance, the support, and even the protection of the response staff.
I know that misinformation seems to be one of the biggest problems you're facing there. What kind of misinformation is circulating?
The one of the misinformation that is circulating is this unfortunately Ebola business thing. People think we are not here to support the community. Still, we perform very critical activities like safe and dignified burials, for example. Like you already know, even after deaths, the body of someone positive to Ebola remains highly contagious. To protect the community, his body needs to be handled following very strict protocol and high standards. Those are the kind of activities the volunteers we've deployed. There are more than 1,500 so far, are implementing on a daily basis on the field. But to do so, we really need to continue dialoguing with the community, having them understand what we are doing, accepting it, and even support it.
Is the message slowly getting across to these communities?
Yes, it is. And I will draw you the picture. You know that in the very beginning of the outbreak, the virus was spreading in the Ituri province first. We had a lot of resistance in the very first day, but we deployed the volunteers who did a very great job going door to door and speaking with the community. Now, this is not to say we are not facing hostility at all, but it decreases in the areas we were in the very beginning. I mean, in the areas we deployed the volunteers because it was the areas where the virus was spreading. The problem now, as the virus continues to spread in new provinces and new area, this is a job we have to start again. We face community who encounter the virus for the very first time. They are not even conscious of the danger this virus represents. They are not even conscious of the essential measures we have to put in place. They are not even conscious of some protocol we have to follow, which we can understand. But the problem is that if the dialogue is not maintained, people will continue to be open to the misinformation circulating. This will fuel the mistrust, and even, unfortunately, sometimes it can bring to attacks against our workers.
Alex, we're going to have to leave it there. Thanks so much indeed for that quick update. And we wish you and your fellow healthcare providers in the region the best. And let's hope that you can get on top of this scenario and then the communities come online as well. Thanks for your time.
You're welcome. Thank you as well.
That was Alex Locke. He's the communication coordinator with the International Federation of the Red Cross and Red Crescent Societies based in Bunia in the Eastern Democratic Republic of Congo. It's time now for your news headlines. Here's Joalani Tulongwepe.
SABC